I am Dr. Harish, consultant laparoscopic surgeon and surgical gastroenterologist. I am the founder and director of IMAS. It's an institute of minimal access surgery, Basavanagudi, Bangalore. I am attached to various hospitals like Apollo Hospital, Jayanagar, Columbia Asia Hospital, Ebbal and Fortis, Nagarbavi. I am the teaching faculty as a professor of surgery in Kempegowda Institute of Medical Sciences. I am going to describe about fistula in ano. Fistula is a most common condition encountered in our clinical practice. Usually the patient with fistula in ano presented with pus discharge in the anus. Occasionally they will have discomfort, pain, on and off bleeding. The usual diagnosis by a clinician, the patient come with the vague complaints. We do clinical examination. Our clinical examination is a painless procedure where there will be a wound in the perineal region. So just I want to explain what exactly the fistula is. It's an abnormal communication between the anal canal and the skin. The patient will misunderstood a wound in the perineal region as a regular wound, and they will have a regular treatment for that. They apply so many ointment for that. So finally they'll come to us. So we diagnose the fistula by clinical examination, and sometimes we subject the patient for endoanal ultrasound scan or MRI fistulogram in a complicated fistulas. The risk factor for fistula is there will be an infection in the anal glands that later leads to a perianal abscess that leads to a fistula in ano. In an early stage, if the patient has pain in the anal region or fever or any wound, chronic wound with pus discharge, they should report to the clinician. So in a later stage, once the fistula is set, it is a cumbersome procedure for the patient for the treatment also. There are wide varieties of treatment options for fistula in ano. Nowadays, the fistula surgery is a very simple procedure and it is a day case procedure. I do wide varieties of procedure, but the most acceptable procedure is laser treatment for the fistula in ano. In our center, we have a lasers for fistula. The patient will call in the morning by 7 o'clock, will discharge in the evening. It's a painless procedure and there will not be any post-operative pain, and patient can be discharged in the evening. The next 2 days the patient can resume his regular activities and there will not be any difficulty for passing stool.